7 exercises that prevent forgetfulness in the elderly. Keys to supporting brain health. Aging is a natural part of life and brings with it many changes. One of these changes is the possible weakening of memory and cognitive functions. Although forgetfulness is a common condition in the elderly, contrary to popular belief, it is not fate. Scientific research shows that regular physical activity significantly supports not only physical health, but also brain health. Exercise plays a critical role in preventing forgetfulness by increasing blood flow to the brain, encouraging the renewal of nerve cells, and strengthening cognitive reserve. 1. Aerobic exercises. Increasing blood flow to the brain. Aerobic exercises are activities that increase heart rate and speed up blood circulation. The brain is one of the organs in the body that consumes the most oxygen, and regular aerobic exercise allows more oxygen and nutrients to reach the brain. This helps brain cells stay healthy and cognitive functions are maintained. How to do it? Brisk walking. A brisk walk for 30 minutes most days of the week is both an easy and effective aerobic exercise. Walking outdoors also contributes to vitamin D synthesis, which is important for brain health. Light running, jogging. If there are no joint problems, light jogging also supports brain health. Swimming, which works the whole body and reduces the load on the joints, is an ideal aerobic exercise for the elderly. Dances. Offering both physical activity and social interaction, dance is a fun way to support cognitive functions. Learning new figures offers an extra challenge for the brain. Cycling, stationary or outdoor. Cycling improves cardiovascular health while also increasing blood flow to the brain. Benefits: increases blood flow to the brain, increases the production of brain-derived neurotrophic factor, BDNF, which supports the growth of new nerve cells and the health of existing nerve cells, reduces stress and anxiety, which are factors that have negative effects on memory, improves sleep quality. 2. Balance exercises, strengthening brain and body coordination. Balance is the result of a complex interaction between the brain and the body. As we age, our ability to balance tends to decrease, which increases the risk of falling. However, balance exercises improve not only physical balance, but also the brain's spatial awareness and coordination ability. How to do it? Standing on one leg. Start by holding on to a chair and gradually try to become unsupported. Try to stand on both legs for 30 seconds. Heel-toe walking. Walking heel-toe in a line improves balance and concentration. Tai Chi. Consisting of slow and fluid movements, Tai Chi improves both balance and mental focus. It also has a stress-relieving effect. Yoga strengthens balance, flexibility, and the mind-body connection through various poses. Benefits: improves balance and coordination, reduces the risk of falling, supports the brain's spatial awareness and movement planning abilities, increases muscle-nerve coordination. 3. Strength training, increase muscle mass and brain power. While strength training is often associated with muscle growth, it also has significant effects on brain health. Maintaining and increasing muscle mass improves overall metabolic health and reduces inflammation. Research shows that strength training can improve memory and cognitive function. How to do it? Body weight exercises, wall push-ups, chair squats, and arm stretches with bands are great for beginners. Lightweight exercises, work your arms, legs, and back muscles using hand weights, water bottles, or resistance bands. Machine-assisted exercises. Weight machines found in gyms are a good option for working your muscles safely. Benefits: increases muscle mass and strength, improves metabolic health, increases insulin sensitivity, which is good for the brain, may promote the release of neurotrophic factors, increases overall functional independence. Fourth, coordination exercises, activating different parts of the brain. Coordination exercises require different parts of the brain to work simultaneously and harmoniously. Such exercises improve cognitive abilities such as motor planning, reaction time, and attention. How to do it? Ball bouncing, holding. Simple ball bouncing or throwing and catching exercises against a wall improve hand-eye coordination. Finger exercises, moving the fingers of both hands in different rhythms or shapes. For example, making a fist with one hand while keeping the other open and changing simultaneously. Rope skipping, low impact. If the joints are suitable, light rope jumping is beneficial for both aerobic and coordination purposes. Playing a musical instrument. Learning a new musical instrument is an excellent coordination exercise that works many parts of the brain at the same time. Benefits: improves motor planning and execution skills, increases hand-eye coordination, speeds up reaction time, strengthens communication between different parts of the brain. 5. Brain exercise and mental exercise, supporting neuroplasticity. Mental exercises as well as physical exercises are vital in preventing forgetfulness. The brain makes new connections as it learns and is challenged. This phenomenon is called neuroplasticity. Regular mental exercises increase cognitive reserve and can delay age-related cognitive decline. How to do it? Puzzles and mind games. Games such as Sudoku, crossword puzzles, chess, and checkers develop problem-solving and strategic thinking skills. Learning a new language. Learning a new language constantly challenges the brain and encourages it to make new connections. Acquiring a new skill, taking up a new hobby such as knitting, painting, or playing an instrument offers new challenges for the brain. Reading and writing. Regularly reading books, writing articles, or keeping a journal increases brain activity while improving vocabulary and expressive skills. Memory games. Playing special memory games such as word recall and number sequence memorization. Benefits: increases neuroplasticity, strengthens cognitive reserve, improves problem solving and critical thinking skills, increases memory and attention span, maintains mental sharpness. 6. Flexibility. Exercises increase mobility and circulation. Flexibility exercises increase the range of motion of muscles and joints. This improves overall physical functionality and can indirectly support brain health. A flexible body allows for more comfortable and balanced movement, which allows other exercises to be performed more effectively. In addition, deep breathing during stretching movements can help deliver more oxygen to the body and brain. How to do it? Stretching exercises. Slowly stretch the muscles of the shoulders, neck, back, legs, and arms. Hold each stretching position for 20 to 30 seconds. Pilates, an exercise system that strengthens the core muscles while increasing flexibility and body awareness. Gentle yoga poses. Light and flexible yoga poses, especially adapted for the elderly. Benefits: increases the range of motion of muscles and joints, improves blood circulation, reduces muscle tension and promotes relaxation. It can indirectly reduce the risk of falls. 7. Social exercises, social interaction for brain and emotional health. Social interaction is a factor that should not be ignored for brain health. Staying socially active helps to keep cognitive functions active, improve mood, and reduce the risk of cognitive decline brought on by isolation. Social activities often require the use of multiple cognitive skills, speaking, listening, problem solving, empathy, simultaneously. How to do it? Join clubs and groups. Participate in activities such as book clubs, hobby groups, and volunteering. Visit friends and family. Spend time with loved ones on a regular basis. Chatting. Participate in community events. Attend events such as local festivals, public concerts, and seminars. Meet new people. Be open to meeting new people in social settings. Play games. Play games that require social interaction, such as board games and card games. Benefits: increases brain activity and supports cognitive functions, increases emotional well-being and reduces depression and anxiety, prevents the negative effects of social isolation, helps manage stress, improves quality of life. General recommendations and things to remember. Consistency is key. Being regular and consistent is essential for getting the most out of your exercise. Even spending a few minutes on each type of exercise a few days a week can make a big difference over time. Variety is important. Combining different types of exercise is the best way to work different parts of the brain and body. Learn to listen. Listen to your body's signals. Stop and rest when you feel pain or discomfort. Hydration and nutrition, drinking enough water and eating a balanced diet, are as important as exercise for brain health. Foods such as antioxidant-rich fruits, vegetables, and fish containing omega-3 fatty acids support brain function. Adequate sleep. Quality and sufficient sleep is essential for the brain to rest, consolidate information, and renew itself. Doctor's approval. It is very important to consult a doctor before starting any exercise program, especially for older people with chronic conditions. Forgetfulness does not have to be an inevitable part of aging. It is possible to protect and improve brain health with regular physical and mental exercises, lifestyle changes, and social interactions. Remember, every small step is a big step towards a healthier and more energetic brain. Starting early, being consistent, and making these exercises a part of life is the key to having an active and productive mind in old age. 10 exercises that strengthen bones. A safe and effective guide for the elderly aging is a natural phase of life and brings with it various changes in our bodies. One of these changes is the decrease in bone density. Osteoporosis, bone loss, which is especially common among postmenopausal women and elderly men, can cause bones to become brittle and increase the risk of fractures even in the simplest of falls. However, maintaining and strengthening bone health is not destiny. Scientific evidence shows that regular and correct exercises play a vital role in increasing bone density, improving muscle strength and balance, and thus reducing the risk of falling. In this guide, we will examine in detail 10 basic types of exercises that will help older people strengthen their bones safely and effectively. It should not be forgotten that before starting any exercise program, it is very important to consult a doctor or physiotherapist and create a program that is suitable for your individual health condition and bone density. The importance of exercise for bone health. Why is it so critical? Our bones are living and dynamic tissues. When they are loaded, that is, when mechanical stress is applied, bone cells are stimulated to produce new bone tissue. This process is called mechanotransduction. In short, when we regularly place light and controlled loads on our bones, they become stronger and denser. The benefits of exercise for bone health are not limited to increasing bone density. Increases muscle strength. Strong muscles support bones and reduce the load on joints. Improves balance and coordination. This is one of the most critical factors in preventing falls. Falls are the main cause of bone fractures in the elderly. Increases flexibility, improves joint mobility, preserves general functional independence, allows you to perform daily living activities more easily. 10 exercises that strengthen bones. 1. Weightlifting exercises. Weightlifting exercises. These exercises are activities where body weight or additional weight is placed on the bones. Movements against gravity stimulate bone cells. How to do it? Brisk walking. A brisk walk for 30 minutes. Most days of the week is one of the easiest ways to put regular and controlled load on bones. Stair climbing. Using the stairs instead of elevators or escalators strengthens hip, leg, and spine bones. Dancing. Rhythmic movements and steps against gravity are a fun way to increase bone density. Light jogging if there are no joint problems. This is a higher impact weight-bearing exercise, but should be done if joints and bone density are suitable. 2. Resistance exercises. These are exercises where the muscles are worked against a resistance. They stimulate bone formation by applying a pulling force to the points where the muscles attach to the bones. How to do it? Working with light weights. Work the arm, shoulder, leg, and back muscles using hand weights, 1 to 2 kilograms, water bottles, or resistance bands. For example, movements such as biceps curls, shoulder lifts, leg lifts. Body weight exercises. Wall push-ups. Standing against the wall and doing push-ups strengthens the arm and shoulder bones. Chair squat. Stand in front of a chair and slowly sit down by bending your knees, then stand up again. This exercise strengthens the hip and thigh bones. Heel. Raise. Hold on to a chair, lift your heels off the floor and rise up on your toes, then slowly lower yourself. This strengthens the lower leg bones. 3. Balance exercises. Exercises that improve balance play a key role in preventing falls and therefore fractures. How to do it? Stand on one leg. Start by holding onto a chair and gradually work your way up to being unsupported. Try to stand on both legs for 30 seconds. Heel-toe walking. Walking heel-toe, sequential, in a line improves balance and concentration. Tai Chi. Consisting of slow and fluid movements, Tai Chi improves both balance and mental focus and significantly reduces the risk of falling. Sidestepping. Take small steps to the side while holding onto a chair, then turn the other way. 4. Flexibility exercises. Stretching. Keeping the muscles flexible allows the joints to have full range of motion and helps to perform other exercises more safely. It also reduces muscle tension. How to do it? Slowly stretch the muscles of the shoulders, neck, back, hips, legs, and arms. Hold each stretching position for 20 to 30 seconds. Avoid sudden and jerky movements. For example, extending your arms over your head and stretching to the sides, sitting down and extending your legs forward and trying to reach your toes. 5. Pilates. A low-impact exercise system that strengthens the core muscles, increases flexibility, and improves posture. A strong core, abdominal, and back muscles can help prevent spinal fractures by supporting the spine. How to do it? It can be learned safely with a Pilates instructor or by attending Pilates classes adapted for the elderly. Basic Pilates movements done on the mat can also be done at home. Sixth, yoga. Exercises that improve balance, flexibility, strength, and the mind-body connection. Especially gentle yoga or chair yoga is ideal for the elderly. How to do it? Appropriate positions for the elderly can be learned with an experienced yoga instructor. Like Tai Chi, yoga is also effective in reducing the risk of falls. 7. Swimming and water aerobics. Low-impact exercises that put less stress on joints and bones. Although it does not directly increase bone density, it improves muscle strength, flexibility, and cardiovascular health. This indirectly contributes to bone health by improving overall physical condition. How to do it? Attend swimming or water aerobics classes a few days a week. 8. Dancing. Not only is it fun, it also has a weight-bearing effect on the bones, improving muscle strength, balance, and coordination. How to do it? Ballroom dancing, folk dances, or simple dance moves can be done at home. Even moving freely to music is beneficial. 9. Gardening. If done healthily and safely, gardening, raking, digging, planting can provide moderate weight-bearing and resistance exercise. How to do it? Squatting and standing up, bending and reaching should be done carefully. Knee pads or support devices can be used if necessary. 10. Walking-based games and activities. Daily activities such as playing with grandchildren, playing light-paced ball games, or being active at the park are natural ways to unknowingly put pressure on bones and work muscles. Important notes. When starting an exercise program, doctor's approval required. Always consult your doctor before starting any exercise program. Get expert advice on which exercises are safe, especially if you have osteoporosis or other bone joint disorders. Start gradually. Never overdo it. Start lightly and slowly increase the duration, intensity, or resistance of the exercises over time. Regularity is important. 30 minutes of weight-bearing exercises most days of the week, and resistance and balance exercises 2 to 3 days a week are ideal. Short, frequent sessions are more effective than long, infrequent sessions. Proper form. It is very important to do exercises with proper form to prevent injuries. If necessary, seek help from a physical therapist or certified exercise specialist. Nutrition and vitamin D, adequate calcium and vitamin D intake are as vital to bone health as exercise. Talk to your doctor about supplementation. Don't forget to rest. Rest is needed for muscles and bones to heal and strengthen. Avoid over-exercising. Drink water. Drinking enough water during and after exercise is important to maintain hydration. Bone-strengthening exercises are one of the keys to improving quality of life, maintaining independence, and living an active life in old age. With a regular and conscious exercise program, you can protect and strengthen your bones and have a healthier old age. Remember, inactivity is the biggest enemy of bones. Movement is their friend.